we are on the right track in terms of where we need to go to cater to the needs of our population. In terms of public health infrastructure, in terms of people, in terms of equipment, in order to address the concerns of our population and in keeping with our long-term vision for sustainable development.
In support of the vision, from April 2019 to March 2020, government will spend over $69 billion on healthcare delivery. The money will cover operating expenses, including salaries, pharmaceutical and medical supplies, and the cost to rehabilitate and maintain equipment and furniture, as well as physical plants in the 4 health regions. Some of the funds will also support the National Public Health Laboratory, blood transfusion services, National Family Planning Board, and interventions for prevention and control of drug abuse.
We want to discourage underage drinking because we see it happening. As a matter of fact, on the tobacco issue, there is a growing trend now which we have to clamp down on, which is worth mentioning, and that is the vaping.
In the new fiscal year, 7 health improvement projects will be jointly funded at a cost of $5.7 billion by the Government of Jamaica and its bilateral and multilateral partners. 2 of them provide intervention to reduce HIV infection rates, end discrimination, and cover treatment and counseling for infected persons.
For us, the first line of defense is always prevention, exercise, balancing their diet, knowing their health status, to minimize the risk. But as a government, clearly, beyond prevention, you have to also invest in the curative side.
Meanwhile, $3 billion of the ministry's capital budget will support the Health Services Improvement Project. It includes partial rehabilitation of the Caenwood Regional Hospital, along with infrastructure upgrade at 7 other hospitals and 3 health centers. The funds will also support training of medical staff, purchasing mental health buses, diagnostic and other medical equipment, as well as vector control. In the new financial year, government will also continue work to ensure mothers and their babies have the best chance of a long and healthy life. This includes the provision of more, better designed and equipped neonatal high-dependency units, manned by well-trained health professionals. The teenage pregnancy rate is of concern to government, and for the year, the National Family Planning Board will heighten public awareness on adolescent sexual and reproductive health and increase access to services. And preparatory and structural works will be carried out towards the construction of a children and adolescent hospital in Western Jamaica. Work will also be taking place under the Prevention and Care Management of Non-Communicable Disease program, supported by the Inter-American Development Bank. 10 health centers and 3 hospitals are to be renovated or improved.
We want to enhance those facilities, and this year you're going to see a lot of health centers being renovated.
Those are just some of the ways government will be attending to the health needs of the nation in the new fiscal year, safeguarding the true wealth of Jamaica.